Good afternoon. The big problem in prevention in Europe is the human belief in that we are rational. And that's why many people believe that you just have to warn people with mass media campaigns so that they engage in protective behaviors. The people from harm reduction movement believe that you can teach to people how to handle risk, and that they then will be able to control the impulses better. Or the alcohol industry says, with appeals that you have to moderate yourself, putting the onus of heavy drinking on the individual alone. And all these interventions are focused only on the individual. And I wanted to show that the big problem, that the big problem is that we believe that we are rational. And that's why, for instance, even big advisory bodies to European governments say, for instance, that prevention is not so really effective, and that in reality it should be recommended that young people should just get accurate information about drug use and about the consequences, and this would give them then the possibilities to make informed choices. These informed choices sounds very beautiful, very politically correct, but as I just said, it has flaws. And this has led that many interventions in member states and prevention policies are based on information only. I have here several maps, and if you look at the maps, the darker a country is, the more a certain kind of intervention is happening there. And you see, simply having only information on drugs without teaching social skills or training social skills is very important. But empirical studies say that, after all, being informed is not protective. For instance, a recent study in Switzerland showed that drug users were much better informed about consequences, effects of drugs, and generally about health than the non-users. So being informed is not protective. Nevertheless, also other informative events or informative strategies, like having only drug days, drug information days in schools, is very frequent. This is the image from 2007, and it changed a little bit in 2011, but not much. Also, for instance, visits of law enforcement agents to school is a very frequent kind of intervention in all European member states. Whereas, for instance, training personal and social skills is not so frequent. In some member states outside of manualized programs, this is apparently not happening. So what is the problem with it? We know that, I just told you that knowledge does not protect you, because we know that many people engage in harmful behavior despite the knowledge that it's harmful, or that it can lead to harmful stuff. So it is not that we would do reflection on the pros and cons of certain decisions we take, of certain behaviors. Basically, we have to remind ourselves that in first instance we act intuitively, and then afterwards we invent motives why we did it. So we rationalize. Mostly we automatically approach certain things according to if the cues are positive or stimulating to us. And this is worse if we have deficits in impulse control, because then the more and more we repeat this kind of approaching certain attitudes because we respond to stimulus, we get an attentional bias. Attentional bias means in a certain room full of other stimulus, we identify immediately the alcohol-related stimulus, for instance. In a certain image, we see the cups of alcohol and see not kind of other important stimulus like faces or people. And these sensorial cues to which we approach automatically lead also to, for instance, that we eat food we don't need, we don't want, and if we're not hungry. The simple presence of food stores along the way between work and home predicts, in some studies, how much people get fat, because they eat more simply because the food is there. So we respond to stimuli. But we have also other environmental cues. which are not so much on the individual, but on what is in our environment around. The most famous are descriptive norms, our perception of what everybody does. For instance, the street musician, they put always a coin in the hat before them, showing basically that everybody has already given some coin. If he was smart, he would also ask some attractive friends of him to pass every 5 minutes and put coins. Empirically, this increases a lot the propensity of people to give more coins. Injunctive norms is the perception of what is okay and acceptable by other people. For instance, here, to put the garbage in a place where formally it would be forbidden to put it there. But as you would also put your garbage there because you have seen that other people have put it there and you don't care that in reality it would be forbidden. And we have also the things I just told, implicit cognition. We are primed to react to certain cues. It is known that people eat 30% more if they eat on a buffet than if they eat in a normal restaurant, simply because we are primed, we are programmed to eat more because we have to diversify our food. So this is the implicit cognition thing. And environmental prevention strategies respond to those, basically. You can do it on a macro level, by regulations at a society level. You can have advertisement bans, you can have buying age limitations, prices and taxes. As you see, these things act on descriptive norms and injunctive norms. They reduce the perception that everybody is doing it and that everybody is accepting it. But you can also do it at lower levels of society, in school, community, and recreational settings. We know that rules and climate in schools are predictors of use of consumption in schools. This would be injunctive norms. The visibility of cannabis in schools is a predictor of use. It's a question of descriptive norms. And if you reduce the density of outlets and licenses for alcohol, for instance, you reduce the effects of implicit cognition because you reduce the stimuli that people see in their daily life or when they go out. And you have the same applied at family levels. It is more protective to have simple rules in families than talking about alcohol. Talking about alcohol with kids, it's basically not very effective. And so we have in our website these prevention profiles that show what member states are doing. Europe is now, since 2004 at least, doing much more in tobacco control. You have these scores when you compare how well countries are doing. We have the same for alcohol. Some Swedish and Finnish researchers have developed a score to measure the strength of alcohol policies across the European Union. But in party settings, for instance, party settings, the same applies. The organization of party settings, of space, of how many males are there, how many drunk people are there, if it's noisy or not, has a lot of influences. But half of member states don't say anything about what they're doing there. Free water is only available in 11 member states. And then only these member states here in the north include alcohol control policies in their party setting interventions. And only these member states here have liaisons, kind of corporations between the party industry and the prevention services. And a little bit in Spain, it's only Catalonia who has that. But we know that the big things are happening in the south. Here in the south, in the big resorts of the south of Europe, happens the initiation of drug use, the escalation of drug use, the diffusion of drug use. Here is where kind of Britons who wouldn't take so much ecstasy at home do it then 5 times more while they are in Ibiza, for instance. But here in the south, not much is happening. So this leads to the importance of normative beliefs. Information is, in fact, a useless thing. I don't say a useful thing. I don't say it's not. But it's useful for people which are well controlled, who have a good self-control, normally females, for instance, and when we are alone. But risk situations are those situations when we are with other people. There is when drug use and drug use initiation happens. So perceived normality is a very important thing, and this leads to the dangers of certain mass media campaigns. First, because they can affect social norms. Maybe the best example is this quite stupid Spanish campaign. It was done by the alcohol industry, by the way. So they claim that the norm would be for young girls to have sex while they're 13, which is not true epidemiologically. But a young girl of 13 reads that the norm, begins believing that she is not normal because she's 13, haven't had sex yet while she was drunk. Whereas then below comes then a moralist thing about this shouldn't be the norm. But the message to young people is this is normal and this is extremely dangerous. So, and there are studies that show that effectively many mass media campaigns suggest to young people that the behavior they want to prevent is normal. And it has another effect on attention bias. It can show, for instance, the more you talk about a certain thing, you draw the attention of young people to a certain behavior. And there came out recently a study which saying that young people nowadays believe that the use of new psychoactive substances is much higher than it is in reality, because there was all this hype about new psychoactive substances which draw the attention of young people towards them, even if very few people are using them now. And then, under this light of what I just said, it is the question if such messages from the EU Justice Directorate are responsible. Is it really a logical conclusion to say that everybody has to be warned about something that only 4% are doing? You might draw the attention of people to something which, in fact, is not so prevalent. The other questions, selective prevention. In selective prevention, we assume that drug use is a marker of other problems, mostly by lack of opportunities. Member states in Europe are doing a lot here. There are interventions for young people in socially disadvantaged neighborhoods. There is an increase of intervention for pupils with academic or social difficulties. As we know, this would lead to more drug use problems. This increased from 2007, as you see here, to 2011. The member states are doing more. And they are all also doing more in the areas of interventions for young drug law offenders. Those young people that have been caught for possession and use of drugs. In countries outside of Europe, the consequences is that they all go to jail or they are put into treatment centers as if they were addicted, but mostly they are not. Now, several interventions have been set up in Europe that are alternatives to that, which are simply 6-week or 3-week protocols of brief intervention or motivational training for first-time offenders. And as the program was quite effective in Germany with good evaluations, it's now being implemented in a third of the European Union with positive evaluation results. And you see that's why the interventions for young offenders increased so much between 2007, what you see here, and 2011, what you see now, because these kind of interventions have spread quite widely. But one interesting thing happens there as well. This is the German evaluation of it, and you see that only 18% of these young people that come to these courses come on their own initiative. All the rest come only because they have been sent by parents, by judges, by the police, or by school. So, again, coming back to the paradigm of that, to act intuitively and rationalize afterwards. Because if you ask these people that come to these FRED programs for young offenders, at the beginning of the program they were saying, oh no, we only had recreational use, we had an alternative lifestyle. When they came out of the program, they admitted that their whole life was basically oriented to cannabis. So many qualitative researchers often say you have to listen to youngsters and their reality and their motives. But if young people, and we all, do not know about our motives and just invent them, what is it then good for? Because German studies ask the Germans, what do you need to have effective prevention? And the Germans said, we need more information. The only thing we know that doesn't work. Or a minority of them were saying, we want nothing, we have the right to self-destruction. Or the Canadian youth said they want to talk more openly with their parents about their drug use. Another thing which is probably not very effective. It's known to be non-effective. Then we come to the next point. Colleagues of mine have been taking countries and the prevalences in those countries and have clustered those countries. And they came out that there are, in Europe, there are high prevalence countries where all prevalences of all drugs are high, and that there are low prevalence countries where basically the use of all kinds of substances is low. Now the funny thing is that in a low prevalence country, a cannabis user has a much more consumption of other heavier substances than a cannabis user in a high prevalence country. In other words, a cannabis user in Sweden is much more problematic in its consumption of other substances and in psychosocial variable than a cannabis user, let's say, in Spain, in a high prevalence country. But this is kind of a dilution effect. Imagine the problem was water. Here, it's full of water, the picture, and you hardly can see the icebergs swimming in it. Reduce the water, and you will see the icebergs, even if they are small now. These are kind of cannabis users in Sweden. In a society which has strong anti-drugs and anti-substance use norms, in order to use cannabis, you have to be really quite special and really quite unconventional. So this leads, there will be always people that are extremely vulnerable at an individual level. You can reduce the overall level of substance use, but there will be always vulnerable individuals. And this leads to the two opposite challenges for prevention, which have not yet fulfilled in Europe. One is to act more on the population level, to act on normality, on the perception of normality, on social norms, on these environmental cues by public policies. And Europe has just begun to do something here. But the other point is on the work on the icebergs, on the individual level, on the very vulnerable individuals. But you have to refine our detection and definition of who they are and how to approach them, and then to target them with indicated prevention or with brief interventions. Because if you ask a typical prevention professional, what would be the most important individual risk factor on people? They will say, obviously, it's all these children of drug addicts. And you see, this is direct bar check studies. There are an increased risk for drug use. But nobody cares about these kids. The children with a behavioral disorder have a much higher risk of developing drug use problems than the others. But in most European member states, nobody cares about these kids, don't want to know about them. And there are very effective interventions for them. One is, for instance, the prevention program. It focuses principally on impulse control. You take pupils of 13 to 16 years, which are sensation seekers and drink heavily because they are sensation seekers. So they do not focus on those young kids that drink because of social reasons or because they are depressed. And then 2 group sessions are sufficient for these kids to learn to deal with their own impulsivity and their personality and their way of reacting to drinking cues. And you have reduction of several important indicators like binge drinking, frequency of drinking, depression, truancy. But you have also other things. You can deal with impulse processing. You can train reconditioning. The thing I just told you about the attentional bias towards alcohol cues, you can train that people diminish this attention, the unconscious attention to these cues without talking about alcohol. This is called cognitive bias modification training, and you can do it on computers, but you can even do it over the internet. Kind of that when people see such an image, an alcohol drinker would see only the alcohol stimulus. I might see the blonde lady. But you can retrain people that they do not look so much at the alcohol-related stimulus in this picture. But the reality in Europe is that most of this is not happening. These indicated prevention programs in total are being implemented in 3 or 4 countries. In the rest of Europe, does basically only early detection alone, and then when they detect drug use, send it to treatment centers or to counseling centers. So it's not really much implemented. And because after all, it's all about impulses and control of these impulses, which is nothing else than socialization. The definition of socialization is where we control our impulses when we are with other people. And we do this in environmental prevention by increasing external social control of what we do. It's quite normal. It has nothing to do with prohibition or with being extremely conservative. And we reduce environmental cues. We reduce the visibility of alcohol publicity, the visibility of substance use. And we can do the same thing in indicated prevention, where people learn the internal control of their impulses by knowing what happens inside me when I see a certain cue. And we can recondition the reaction to cues. But the point is that traditional prevention and traditional harm reduction totally ignore all this. They rely still, in their majority, on cognitive processes, on information, on warning. It is just what Gilberto Cerra said before. There's a big gap between what we know that works and what we actually do. And people focus still very much on just increasing self-competence of the individual, as if we were living alone and not being totally conditioned by our social environment. And this leads now to my last slide. We should really consider the big choices in prevention. We can continue to do persuasion as before or look at scaffolding. Scaffolding means changing the environments around people but not necessarily want to change people themselves. That cognition is not so important as the emotions we have. When we are informed, it is not relevant how well we are informed if we are excited in a certain group environment, because then we don't use any of this information. And regarding many statements of harm reduction, we don't make rational risk assessment. We make an automatic approximation to cues. That's it, because we are not rational. And here I've ended. Thank you.